So again, we can do an hour on when is the right time for plastic surgery. And as plastic surgeons, it's phenomenal because we operate from the day of birth on to the very last day. In as much as we plastic surgeons do cleft lips and palates.
Sure. And those are often young.
Yes.
Right.
So a few days because they can't suck, they can't eat, all that. So so do that hand as well if you have extra figures, if you have syndactylly fingers stuck together, and all of those.
I mean, because obviously part of that, the cleft palate is obviously a health issue to begin with, but then also is there a consideration for getting that done before they actually get into school?
Oh, of course. So so again, you want to do that. Well, for a variety of reasons. One is on the cleft lip, cleft palate thing, is you want them to have, in a perfect world, and so many centers of excellence are set up all over the place, is you have the plastic surgeon, this is a team now, the plastic surgeon working with the orthodontic people working with the speech pathology.
That really is a team thing.
Yeah, right? Speech pathology is key for those folks to go ahead and be able to, say the PPPs and those sorts of things. And
you want to do that.
Swallow
you want to do that when they're young before they
and swallow and swallow correctly, et cetera, et cetera. I mean, if you go on one of these missions, you do the best you can, everything else. But here in the States, most of the university teaching hospitals now have cleft lips and palate centers, and they do phenomenal work, and I don't do any of that anymore because they do such a good job of it.
Right, that's pretty much all they do.
And I send it to those.
And they have it. There's
folks.
actually medical teams that go to South America.
And they do phenomenal work. Right. And there's a bunch of them out there, whether they do burns or they do hands or they do cleft lips and palates or they do whatever. But the medical missionary stuff is phenomenal. What those guys and gals can do. Getting back to when is a good time? And we talk about this. I mean, the cleft palate is easy because you do that as soon as they're stable and big enough. We talk a little bit about ears. When is a good time to get your ears pinned back?
And what's that? That's procedures.
It's called an otoplasty. Okay. Oto meaning ear, plasty meaning to shape or form. Okay. That's your Latin lesson for today.
Yeah, good.
Sister Mary with the Latin. Okay, so otoplasty. So it's basically your ear pinning and that kind of stuff. And so those kids, typically you want to get to them before they start to hit school age and get started in T's, Dumbo, this and that. Right. So, but we've been catching a lot of kids, and this is one of the classic Hollywood plastic surgery moments. There's a gal who's 16, 17, right? And doesn't want to play sports because she doesn't want to put her hair back. Yeah. And it gets teased all the time. And it's tough enough growing up, right? And so they come in, and mom comes in with them and stuff. We talk about things. And with one operation, you go to the operating room and you do your thing. And that's a nice operation because the scar is actually behind the ear. So nobody sees it. Right? So it's really cool, and so it's the classic Hollywood moment that the patient is in the room, and she's up on the little patient seat, and you give her a mirror and you start unwrapping the dressings, and the dressings come off, and she looks in the mirror and starts crying, and
it's life changing, and
mom starts crying, and that is the moment that really plastic surgeons live for. Is all the training and all the stuff you got to do and all of it. It's the ability to make a difference in somebody's life.
Sure.
And that's when it gets really cool. That's the cool part of it all.